Hello, everyone, and welcome to today's webinar hosted by the Oregon Office of Rural Health. I'm Rhonda Angers, the RHC Program Manager. The webinar you are attending today is titled, How Can I Help You? Creating an Awesome Patient Experience Every Time, presented by Lauren Harris. Lauren is passionate about medical practices and enjoys partnering with them to see them succeed. After years of honing her skills within large and small organizations of multiple specialties, including an RHC and school-based health centers, she started her own consulting practice in July of 2020. She partners directly with practitioners and leaders to provide business and operation expertise. Lauren started her healthcare management career in 1992 and achieved her MGMA CMPE certification in 2008 and her FACMPE certification in 2013. Before we begin, I have a few housekeeping details. This webinar will be recorded. Eric Jordan will post the slides and the recording on the Office of Rural Health website within the next few days. Thank you to Eric, who is our tech support during the webinar. If you encounter a technology problem, enter your questions into the chat box and he will assist you. You are all currently muted and your video is off. Lauren will be happy to answer your questions at any time during the presentation. Enter your questions in the chat box and I will read your questions out loud. I am going to put a link to a survey in the chat box. If you would please complete the short survey by the end of the presentation so the Office of Rural Health can continue to provide the resources most helpful to your RHC. Now, without further ado, Lauren, the screen is yours.
All right, thank you, Rhonda. Really appreciate the opportunity to come and talk to you again today. And this topic is so near and dear to my heart. I've been in customer service since I started in healthcare and even before that in retail. So I'm excited to share some things with you that maybe you'll be reminders, but they might also be a few new ideas that you haven't heard before. And then if you've been to one of my sessions in the past, you know I like to give you tools and things that you can take away and start doing immediately today. So as we jump into today's objective, we are first going to talk about what customer service is and why it matters. Then we're going to talk about your role in the patient experience and more about that, and what the skills and behaviors are of customer service experts. So those folks that really hit it out of the ballpark, what do they do? And of course, this is an important one. How do you respond when you have a dissatisfied patient? And no matter how hard we try, sometimes that's going to happen. So I want to give you some ideas on dealing with that situation. And as I mentioned before, we're going to have sample scripts and some checklists and some other fun things at the end today too that you can take away immediately. So our first concept, what is customer service and why does it even matter? So I believe that customer service is a series of activities that directly affects a patient's experience with our practice. And what I mean by that is, regardless of our role in the organization, what we say and do matters. It really makes a difference in the way that the patient perceives receiving healthcare in our organization. I'm going to pop up some logos here of different companies that are known for their customer service. And what I'd like to do is give you a moment to think about words that come to mind when you look at these companies and you think about customer service. Does anybody want to type something in the chat about what words pop up for them? Give you a minute to do that. Anything in there yet, Rhonda?
Yep, samples.
Samples. Oh, that's a great one. Yeah, when they think about Costco, you get to try stuff before you buy it. That's wonderful. Anything else?
Over-delivering.
Over-delivering. Oh, gosh, I want to know which company that is.
Good return policy.
Great return policy. Yes, Zappos, the shoes company, they're known for that. Absolutely.
Amazon Easy Returns.
For sure. Oh my gosh, I did a new thing the other day where you download a QR code, you take it to the UPS store, they scan it, you immediately get credit for that return. Amazing technology. Yeah.
Quick
Think
ship
about, quick shipments. Yeah,
and consistency with customer service.
absolutely. So all of these companies are known for creating brand loyalty through their customer service experiences. There's even a Disney school of customer service, right? So we know that these companies are known for that. You can go into an Apple store and talk to a genius who is an expert in the products that they sell. And you have you have a great experience with that product because you're talking to someone one-on-one and getting the help that you need. So I want you to think about what you do every day and how it relates to these types of businesses and what they're delivering. And healthcare is changing. It's much more patient focused than it's ever been before. And patients have a choice about the care that they receive. And you might think, hey, we're the only clinic in town, so they really don't have a choice. Well, I would suggest that that is not true. There is a lot more telehealth going on. There's a lot more people traveling to receive care than ever before. Even internally, a patient could choose to see a different provider in your practice if they're not receiving the care that they expect from that particular care team. So I want you to think about that, how we can change what we do every day to focus more on the patient and the patient's needs. And I'll give you some tips around that. So the goal with healthcare is really to treat the whole patient. And by that, I mean, of course, the body, also the mind and the spirit. And a lot of what we do when we do customer service work is around the mind and the spirit. We have the clinicians who are treating the body. So think about how important your role is in supporting the patient's health of their mind and of their spirit. And do you want to know a remarkable side effect of providing an exceptional patient experience? This is absolutely true. Happy patients create a more positive work experience for providers and staff. Well, of course they do, right? If you have an unhappy patient panel or an unhappy experience with patients, they are going to make your day harder, and they're going to make your clinicians' days harder. So what can we do to provide an exceptional patient experience every time? Your role, regardless of what it is in your organization, it makes a lasting impression on patients that you interact with. And the times when you get that opportunity are things like when you greet patients, when you register patients, when you respond to their questions, when you're collecting their money, that's a big one, when you're answering your telephone, scheduling appointments, taking messages, maintaining the reception area or the clinical space, and when you communicate delays. Those are all what I call moments of truth. Those are any instance when the customer or your patient has an opportunity to make a judgment about the quality of service and care that they're receiving. So you have lots of opportunities when you're touching the patient to make this lasting impression. And let's talk about your particular role in the patient experience. But first, we have to define what is a patient experience or the patient experience. It really encompasses the whole range of interactions that patients have with the healthcare system. So it starts with the interactions they have with their healthcare plan, their insurance plan. Also, of course, the interactions that they have with doctors, nurses, staff in the hospitals, laboratories, ancillary services, physician practices, every healthcare facility. That all comes together to make what we call the patient experience. And what I want you to know about this is that patient experiences set the expectation of the care that they receive. So the way that people are treated, the interactions that they have with all of those folks that I mentioned before, that is coloring the lens through which they see the patient care that they are receiving. So I want you to think about this for just a moment. You could have the most highly skilled, top-tier educated physicians and nurses on your staff, the most clinically expert people in their field. But if you can't provide a high-quality experience for your patients on a consistent basis, they will not recognize you as being an organization that delivers outstanding healthcare. All of those bad experiences are going to cloud their judgment when they think about their clinical care. That's pretty heavy when you think about it. That is the impact that we have to make on people's lives. And that is the impact that we have to support our clinical teams every day. So the patient experience, as we talked about, it really begins before the patient's visit. It starts with things like the first phone call that they make to schedule that appointment. But even before that, for many of our patients, it starts with the access to our website. And what I want you to think about here is, what does your website represent about your practice? Is it easy to use? Is it easy to understand? Do you have an active patient portal where you're encouraging patients to communicate with you securely, of course? All of these touches are going to affect how they live the experience that they receive clinically in your office. So really, when it comes down to it, do you know what to do and how to do it to create an exceptional patient experience? Well, maybe you need a refresher or two. So we're going to talk about some details today. So I'd like you to think about, regardless of your role in the organization, you could be C-suite, you could be medical assistant, you could be patient service rep or front desk, reception, whatever your role might be. And you should always have these things in the back of your mind. Be striving to reduce barriers. So make scheduling and building access easy. Make sure that you have signage that's useful for people so they can find where they need to go inside the building access. When we say reduce barriers, I mean literally and figuratively. Make it easy for people to physically navigate around your facility and make it easy to access your services. Work on being efficient. So have all the information that you're going to need immediately available, such as the payer plans you participate with, provider biographies so that you can explain the education and style and practice experience of the clinicians that work on your team. Continually improve access to providers and resources to match that patient scheduling need and request. And what I mean by that is, if you notice one provider is getting really full and another provider's panel is not as full, work with your manager if you need to balance that and to find opportunities to maintain access at an even level for patients and for the clinicians. It serves both more effectively. Also work on ensuring that your patient-facing resources are accurate on your portal and on your website. So I can't tell you how many times I've worked with practices and I've given them a patient where I've gone to the website to look for more information, and what I find isn't accurate. Either that doctor's not there anymore, or there's a link that's broken, taking me to a 404 error. There's nothing more frustrating when you're a patient and you're looking for something that you need to be hit with that roadblock or that speed bump through your website or your patient portal. And also work on making online scheduling easy and accurate. And this is a little bugaboo. I know some practices don't even allow any online scheduling. And trust me, I've heard all the reasons why not. I understand them. But if that's the case, and you have the ability for patients to at least request a future appointment through your portal, make sure that somebody is checking those messages and looking for those things. I worked with a practice recently who had this ability on their website for a patient to request an appointment, but there was no one on the other side in the practice managing that inbox. Wow, what a disappointment for the patient, and what a frustration for the practice who isn't filling their schedule effectively simply because there was something broken in the workflow. So make sure that your online scheduling, if you have it, is easy and it's accurate and it works. Strive to explain, and by that I mean provide timely updates if delays occur, and delays do occur. We all understand emergencies come up. Make sure that you're communicating with your patients when those things happen, and be upfront about their financial obligations. Nobody likes a surprise bill. The thing to be thinking about now is credit card on file, keeping ways that patients can make their payments easy for them, explaining upfront what their financial obligations will be so that they understand. And like we said before, making sure that your patient-facing documents, so just like up here where the patient-facing resources are accurate, you want to make sure those documents that you're giving out are current, neat, and easy to understand. And if you haven't updated your HIPAA or your privacy policy in a while, take a fresh look at it. There are some things that have changed, and you should be giving out a more recent version. One thing that I often see in practice is too are out-of-date history forms, out-of-date new patient packets, copies of copies of copies that are hard to read. Take a good look this afternoon. Go back to your practice and pull out your new patient packet. Does every document in there represent the practice in a way that you are proud of? Does it send the message that quality is important? Does it make it easy for the patient to complete and for the clinicians to read when they get the information? Anticipate and be empathetic. So asking patients about their needs via surveys and conversations, and I know most of you have focus groups or patient feedback groups. Those are wonderful. I know you're oftentimes doing surveys as well. Communicating that not only are you asking for that feedback, but that you're taking action on that feedback creates a communication loop that can be so helpful for your practice. And really personalize care to the patient's needs. And I know that sort of sounds ethereal, but when you think about that, think about if a patient's traveling, for instance, a long distance to come and see you, can they have multiple appointments at that same visit so that they don't have to be going back and forth between home and the hospital or home and the clinic? Being proactive about what the patient's needs might be while they're in the office, talking with clinicians about allowing multiple refills, for instance, on routine medications. Those are the things that can really serve a patient more effectively. Continually review your wait times. So take the time to actually observe and document how long is it taking patients to be seen from the time that they check in. Are you working them through the cycle, as we would say, in an effective way? Are they waiting a long time? Hopefully not now in the lobby, because we don't want a lot of people backed up in lobbies, but even in the exam room. Are they waiting for their clinician for a long time in the exam room? And if so, what can we do to dial that back? And I love this idea of observing other team members and providing feedback to one another. So what if you created a project where you could directly observe a different care team than one you're a part of? Or if you're in the front office, observing the back office for a certain length of time and giving that effective feedback. That serves two purposes. It not only improves the patient experience, hopefully, because you're going to see opportunities that can be tweaked or changed, but it's going to build relationship. So when you provide this feedback and these observations with your care team members, you are learning more about them, they're learning more about you, and you're building trust among each other inside the team. So I think that can serve a couple of really great purposes. Make sure that you're following standards, policies, and procedures to create consistency. So what you don't ever want is a patient to get one experience with Dr. Smith and his MA and a different experience with Dr. Jones and her medical assistant. You want to create consistency and have those standards throughout your practice so that the patient experience can be duplicated throughout the entire clinic. Exceed expectations. So this is a great one. Think about not only what the patient expects, which is of course to come in and be seen on time and be well cared for by their clinician, but how else can you stand apart? How else can you really exceed that expectation? What can you anticipate that that patient might need that they didn't even know they might need? This can be something to talk about at a clinic level, and you might be surprised at the ideas that you come up with. So I love this idea of not only meeting expectations, but really striving to continually exceed them. And follow through. Ensure that patients have what they need after the visit, like accurate and timely referrals. Make sure that the after visit summaries are completed and that they land in the patient portal or that they're mailed to the patient's home. Make sure that refills are done timely, other orders are completed. This is where a lot of things can drop off. And even if the patient has a great experience at check-in, they're roomed effectively, they see their clinician, if that referral doesn't make it where it needs to go, or those lab orders don't make it into the lab and the patient shows up ready to be drawn, you're going to take 10 steps backwards in the patient experience. So this follow-through piece is something that I don't think practices spend enough time really looking at. But as we talked about earlier, observing other team members and providing feedback, if you take the time to observe an entire workflow for a patient's entry to exit and you watch that follow through, you might find other opportunities to tweak the process and improve. So I'm going to stop for just a second and see if there are any questions so far. Anything in the chat or any clarification anybody wants me to make so far?
No, there are no questions at this time, Lauren.
Okay, great. Well, the next thing I want to talk about is, do you know why you do what you do? And if anyone's willing, I wanted to give a little bit of space to think about what your organization's mission is and what your organization's values are. Yet.
There, we lost you for a minute.
Oh, I'm here. Okay. Anybody type anything yet? Okay.
Oh, no comments at this time.
Okay. Well, I wanted to just give you a couple of ideas then. So if your values are around respect, for instance, make sure that what you're delivering every day in your particular role is demonstrated respect toward your patients and toward your coworkers. So your homework, if you're willing to accept it, is to go back today, look up your organization's mission, what their values are, and how your particular role works to serve those goals. So concept number 3, we're going to talk now about skills and specific behaviors of customer service experts. So when you think about those companies that we talked about earlier in the beginning that have really exceptional customer service, what do their employees do? What does it look like when they're demonstrating exceptional customer service?
Lauren?
Yes.
There are a couple comments from Barb Harrison to provide compassionate quality care in a family-friendly atmosphere. And then
Fantastic.
Good Shepherd Healthcare System's mission is to improve the health of our community.
Fantastic.
Values. Can you read the Q&A box?
I don't have them.
Okay, you don't have access to that.
No, I can't.
Good Shepherd Healthcare System honors and adheres to the following set of values for our patients in both practices and principles. Quality. We are committed to excellent quality, which includes clinical outcomes, the safety of patients, visitors, and staff, as well as patients. Family and payer satisfaction. This is an important aspect of the larger focus Good Shepherd has on the quality of healthcare we provide. Yeah. Compassion. We will show patients and families. That's all I have there. And in my role, I believe I show that every day by treating people how I want to be treated and helping people get the care they need, not treating them like they are just a number. Yeah, exactly. Building healthier communities together. So those are the comments.
Those are great. Thank you.
Yeah,
Thank you so much for sharing. I think if you stop and think for just a moment about your particular role in your organization and how the work that you do fulfills that mission and values, it gives you a sense of why, right? Why am I here? Why am I doing what I do? And how can I deliver what I need to deliver more effectively? So I think it's very grounding. So thank you for those of you who shared that. I really appreciate it. All right, so as we were just saying, customer service experts, they know how to consistently demonstrate these skills: a positive attitude, affirmative language, smile when you're speaking, even when you're on the phone, even when you're wearing a mask. Tell patients what you can do to help them or solve their concern. There's nothing more frustrating than a customer service person who says to you, well, I can't do that, or we don't do that. Think about and tell your patients what you can do to help them or to solve their particular concern. Excellent customer service experts, they demonstrate attentiveness and active listening. And by that, I mean they repeat the patient's concern or request. They ask for clarification when needed. They stay focused on the caller or the patient in front of them. They take notes if needed. They slow down and focus. So we've all heard about the studies that say that multitasking really isn't very effective. And it's really, what is it, doing several things at once poorly? I think that was a great explanation that I heard. And it's true. If we are trying to really empathize and serve a patient, we need to be with them in the moment. We need to look them in the eye. We need to be listening carefully to what it is that they need. And empathy. Here's some great language you can take away today. So when you're listening to a patient describe something to you, if you use words like, I understand, or I appreciate, or that must be hard, those demonstrate empathy. And those build trust immediately with someone who's telling you about their concern. Integrity. This is doing the right thing even when no one is watching, and thinking about the final outcome of your behaviors. So when you're demonstrating integrity with your interactions with patients, it means if your manager's not there to ask a question of, you're going to make what you believe is the right decision at that moment to serve the patient. And you're going to think about what you're actually trying to achieve for the patient. And you're going to stand behind that action because you know it's the right thing to do. Patience, oh gosh. Allowing others to express their frustration, counting to 10 before you're responding, breathing, focusing on your role in solving the concern. This is an important skill that excellent customer service folks have, and it's patience. And I know sometimes you can feel your heart beating, you can feel your face flushing. We'll talk a little bit more about what to do when you have an angry patient in front of you, but being able to ground yourself and calm yourself and demonstrate patience even in those stressful situations, that's a really great skill to practice. Resourcefulness, staying curious, learning constantly, researching solutions and sharing your knowledge. So be that person on your team that looks things up, that finds the answer, that tells the patient, you know, I don't know, but I will find out, and actually does that and gets back to the patient. Be that one who really demonstrates that resourcefulness. Responsibility. So great customer service professionals, they own what is theirs. They take it on, they do what needs to be done, and then they direct things to others if needed. So they use language like, is there anything else I can do to help you today? And they mean it. It's not just a script, it's something that they're really heartfelt when they use those words. Promptness. And this can be a tough one, keeping patients focused if needed. So I know clinicians get a lot of practice with this, but keeping a patient focused when you're taking a history or even when you're registering the patient and trying to help stay aware of the time when you're taking calls and checking in patients. So there is a little bit of a balancing act that goes on sometimes when you have a very talkative patient and you want to gather all of their information, you want to demonstrate patience and active listening, but you also need to keep sight of the calendar so that you know, or the clock rather, so that you know when the next patient's coming in. And tell people if delays happen. Patients don't like to be left in the dark. None of us do. If we're sitting in a room waiting for a clinician and it's been 10, 15 minutes, even if we have our smartphones, it's still a very long time. And it goes a really long way if you can just let them know, you know what, Dr. Smith is running a bit behind today. I'm so sorry. I will be back in and check on you in 5 minutes and make sure that either he's here or you're being taken care of. So now let's talk about how to respond to a dissatisfied patient. And it's, oh, this funny face, it's going to happen sometimes. There are circumstances that occur that leave people disappointed. And so how do you deal with that? Well, I want to share a concept with you called service recovery. And even if you've heard it before, we're going to go in depth just a little bit more than maybe you have before. But service recovery is the action that a service provider takes in response to service failure. That's a lot of services. All it means is something didn't go according to plan, and the patient is disappointed or angry or upset in some way. The recovery part is what you do in response to that. So it's really true that it's a company's resolution of a problem from a dissatisfied customer that converts them into a loyal customer. So if you think back about an interaction that you've had with a company in the past where something didn't meet your expectations, how they resolve that or how they communicate with you during that process completely changes your view. You'll either remain a dissatisfied customer or patient, or it will convert you into someone who will stay their patient or their customer for a very long time. So it's a big deal. Learning this skill can make a real difference. So when it comes to service recovery, there are 3 rules to keep in mind. And this isn't me. This is from L. Berry, Discovering the Soul of Service. First, do it right the first time. Second, fix it properly if it ever fails. Third, remember, there are no third chances. And that's a little bit tongue-in-cheek. I mean, of course, patients will give us more than 3 chances sometimes, but sometimes they won't. And if you think about an interaction you've had with a company, if something's gone wrong, you may not give them a third chance. If they don't fix it properly, they don't fix it to your satisfaction when you point out that there's a gap, you may just go take your business somewhere else. And patients are the same way. So when something goes wrong, what I'd like you to do is intervene. So take ownership. Comes back to that responsibility word again. I want you to step up and step into the conflict, which can be hard, I know. But the first thing to do is apologize and acknowledge. You can simply say, I'm sorry that that occurred. I'm sorry that we are running late. I understand that will make you late for your next appointment. I'm sorry for that. Acknowledging the circumstances, apologizing to the person makes a huge difference. Step 2, listen, empathize, ask open questions. So take a breath, tell them that you understand, and ask open questions. How can I resolve that for you today? Be open to the feedback that they give you. And then work on fixing the problem quickly and fairly. So think about what you can do to resolve that particular situation as quickly as possible. And then offer atonement. And what that means is some sort of repair, some sort of way to fix it. So I know of a particular practice, for instance, where if their clinician runs more than 15 minutes late, they have a coffee card that they give out to the cafeteria that says, we're very sorry that we were running late. We'd like you to go and get a cup of coffee on us. Something small and simple like that is still a very impactful gesture. Hopefully they don't have to do it too often, but it's a nice thing to be able to offer someone and say, I am acknowledging that we disappointed you and here's something in return. And then follow up. So what I'm thinking here is if you have the opportunity to ask the patient, did we resolve your situation? Did we, at the end of the visit, were we able to resolve it to your satisfaction? Follow up with them. And that can even mean a phone call a week later if something has gone really wrong, and just checking in with the patient, letting them know that you're still thinking about them and what occurred. And then remember your promises. This is that follow through piece. If you say you're going to contact that person tomorrow with lab results or with that referral that they didn't get, make sure that you follow through and you do it. Again, this is where sometimes people fall down. And you can go through all of the steps above, but if you don't deliver on that final promise, it will completely take everything off the rails and disappoint that patient. And in fact, it takes you farther back because now you've broken a promise to them.
Lauren?
So
there's a comment from
Great.
Julian Cochran, and it's a great idea. She says, we have a service recovery toolkit located at all of our clinics for employees to use when needed. It has gift cards, coffee cards, etc. to give to patients in real time to help with situations. That's a great idea.
Perfect. That's awesome. Yeah, we're going to talk about that a little bit further down. I love that. So that's great. What's the value of really having a service recovery culture? It empowers employees to take quick and decisive action, just like she described when something's gone wrong. So if you have a culture that this is what we do here, You've empowered people to make the right choice in that moment. And it can turn a potentially disastrous moment that matters. So any instance when a customer comes into contact with the organization and they're forming an impression into a positive experience. And this is one thing I love too. It really creates a learning culture in your organization where identifying and resolving complaints becomes a positive strategy that your organization takes, right? And it's something that you talk about, and it becomes a springboard for performance improvement because you can say, hey, that clinician is always running 15 minutes behind, and I'm giving out coffee cards every time Dr. Jones is on the schedule. What can we do to make Dr. Jones's day go a little more smoothly, right? And we learn from these things. It can also be used to identify and correct problems before the customer even encounters them and to improve service before a patient is discharged. It's a vital communication tool for listening and learning and then changing course. And this is important. It curbs bad public relations. So dissatisfied customers or patients have a tendency to tell others about their bad experience. We know this. We've done this ourselves, I'm sure, when we've experienced something negative at a company. And this erodes trust in the organization and the caregivers. So as we said before, the interactions that we have on a customer service level, they either build up or take away from the trust that patients have in the clinical care they're receiving. So again, thinking about this, not only are people forming impressions about the customer service they're receiving, but also the clinical care. And finally, it reduces legal risk. So unhappy patients are the ones that are most likely to sue you. And it's just true. And anything you can do to recover and solve a problem before it becomes a bigger problem is going to mitigate some of that risk. So this slide is especially for supervisors, and this talks a lot about what the commenter said. So staff need to have the authority to make decisions about handling complaints autonomously so they can act quickly. So I suggest making sure that staff are clear about the extent of their authority to act on those complaints, that they have those defined courses of action, that there's minimal red tape. So like she described, you can just go and grab that coffee card or whatever it is to resolve the situation, and that there's a clear system of resources, people, clear authority lines, and backup systems for when something doesn't go quite right. So supervisors, this one's for you. Think about how you can set this up to make your front desk and your clinical teams more effective in resolving patient complaints. Breathe for a moment in case there's anything else. Okay. So we've got some additional reminders here, and this can be hard in the moment, but remember that this is not the patient's best day. So when they're having a breakdown, a tantrum, whatever it is, it's often because of something that has nothing to do with you. They may be scared. Fear oftentimes comes out as anger. And when patients are not getting what they need and they're scared about what the outcome might be, they can come across as very angry or hostile. And it's important for you to take a breath and just think, hey, this is not Dr. Smith's, or sorry, this is not Mr. Smith's best day. This is not the day he wants me to remember for him. And this is an opportunity for you to demonstrate your own empathy, to understand and manage your own emotions, to take notes and share with others later, like we talked about, so that you can learn and improve as a team. And when a policy needs to be followed, remember, clear is kind. I love this saying. And what it means is if you need to collect a copay from a patient and that's what needs to be followed, the way to say that is something like, it is our policy to collect copays at the time of service. How would you like to pay today? So being clear in this is our policy, this is what needs to happen, and then giving them an opportunity to answer and resolve that, that's the kind way to do it. If you don't tell someone that they have a copay that's due and they get a bill later that then they have to hassle with, that's not the kindest way to handle that. It's creating more red tape and more confusion and more hassle for the patient. Just think about this in your own work every day. To be clear is to be kind. And explain what you can do to help. As we said before, give people options. And sometimes when people are angry, they act like toddlers because that's just the angry part of the brain that comes out. Do you think? Okay, right. I'm sorry if we're having connection issues. I didn't know. I'm so glad we're back. Okay. So I'll jump into some more real tools that you can use today, and we'll leave some time at the end for some questions too. Does that sound good?
Yeah, that sounds perfect.
Okay. Well, you may have seen this before, but just in case you have not, the Studer group came up with this concept called AIDIT, and it's taught in a lot of hospitals and health systems, but I wanted to share it with you today or just remind you about it if you haven't seen it in a while. So the A stands for acknowledge. Acknowledge the patient and address them respectfully. So many hospitals and health systems have rules or policies that say when someone's walking towards you, you will look them in the eye, you will acknowledge them, you will say hello. That is the A in AIDIT. The I is introducing yourself and others, giving a brief overview, which builds confidence and trust. So how this shows up is if I'm the medical assistant, I go out to room the patient and I say, Mr. Jones, I'm Lauren. I'm here to room you today with working with Dr. Wilson. And I'm so happy to see you today. I've been a medical assistant here for 6 years. Very nice to meet you. So introducing yourself and letting people know who you are and what your role is in the organization. The D stands for duration. Let people know how long things will take. How long is the wait time? Again, it's nothing more frustrating than being locked away in a room and not knowing if anyone's ever coming back. So make sure that you let them know, we're going to send you to the lab now. Your wait will probably be about 15 minutes, and the technician will take you back and draw your blood. E is for explanation. So making sure to let patients know what tests they're taking or what happens next or what's going to be billed to them, being mindful about explaining the next step. Healthcare may be really familiar to most of us, and we may be very comfortable in this space, but for most of our patients, this is not a common occurrence to be in a hospital or in a clinic, and they don't know what happens next, and they don't understand what all of the steps are in this complicated process. So take time to explain them to them. And then the T is thank you. So making sure to say thank you for coming in today. Thank you for choosing us for your care and demonstrating a true appreciation for the patient. Is anybody using AIDIT in their organization that wants to pop up and say something?
Yes, Christina Derry said that they focus on AIDIT a lot in their organization, and so did Jillian Cochran.
And it's all sort of common sense stuff that we need to be thinking of fresh in our minds every day and all of these steps. So good to hear that you're using it too.
Yeah, as a matter of fact, Jillian said that we have it as part of our name badge.
Oh, that's cool. So you can never forget it. You look at your colleague and it's right there. That's fantastic. So I wanted to also present this idea that your colleagues are your customers too. And some things to remember would be to encourage some candid communication and teamwork by getting to know your coworkers as people. So that makes a huge difference. Getting to know who has kids, who has dogs, who has special interests outside of work. That goes a long way in delivering better service to one another because you become more invested in one another. And this is the same idea. So help your teammates get or stay engaged in their work. And I've talked about this in another session, but there's something called levels of engagement. So employees, including yourself, all experience different levels of engagement at different times in our employment. And those are highly engaged, engaged, and disengaged. And if you start to see an employee who used to be highly engaged drop into the regular engaged or even the disengaged section, it's time for you to speak up as their colleague and say, hey, I've noticed that something seems a little bit off with you this week, this day, this month. Can I help you sort something out? How are you feeling? What's going on with you? And something else I want you to think about, that the clinicians that you work with are typically really high achievers. They're visionaries. They are taught to question. They are competitive. They are confident, and they are often very data-driven. So communicating with them and serving them in ways that align with their work and their personal styles goes a long way. So if you're a leader in your organization, you work with a group of clinicians, you know who I'm talking about. You know the doctors who want you to just drop the report and run, right? You know the ones who are very competitive about their quality management scores. You know, the ones who are always having a fantastic idea about change and what we should be doing next. Think about how you can serve their particular styles more effectively by recognizing those characteristics in your colleagues. All right, so here's some sample scripting as we get into this, and you'll get copies of these slides too, so we don't have to go into all of these, but there's some really great content here about what not to say and what to say. So instead of saying something like, I don't know, and then stopping, say something like, that's a good question, let me check and find out. Or, I don't have the answer right now. I will get back to you within the next 15 minutes. Will that be acceptable? And then wait for a response, of course. I'm sorry for the inconvenience. What is your telephone number? So giving them an expectation of when they can hear back from you if you don't know the answer, instead of simply stopping with, I don't know. And as we talked about before, instead of saying what you can't do, let them know what you can do and find that alternative solution. And never say this, no one can help you. Oh, that one just hits me. So if you can say something instead like, I'm sorry, but no one in our business office is available right now. Would you like to leave a message on their voicemail, or may I take a message for you? Again, letting the patient know what you can do for them and not what's not going to happen. Another sample script for no one can help you. So, oh, looks like that's a duplicate, sorry. And the last one is, instead of saying no, let them know what you can do. So we would be able to have the results by noon tomorrow. Where can I reach you? And then make yourself a tickler so that you follow through. Don't disappoint that patient by saying that you're going to do something and then don't do it, because you will lose credibility by doing that. So here's another one. So instead of saying, who is this? You can say something like, may I have your name, please? Or with whom am I speaking? This is old-fashioned manners stuff, but I am continually disappointed with certain businesses who don't train their staff in how to communicate effectively. So these are actual scripts you can take right away to your team and share. And you can provide feedback to one another by observing one another and saying, you know, I heard you say, hang on. Could you please say, may I please put you on hold? Or give them a substitute script to use instead. And the other thing that really drives people crazy is if you say, please hold, and you put them on hold, and you don't give the patient a moment to respond. If that patient is having a crisis or needs medical triage, not only have you not served them effectively from a service level, but you have potentially caused clinical risk for them and to your organization. So never, ever, ever say, please hold, and immediately put somebody on hold. Here's some more scripting around how to ask for name and date of birth and who their clinician is or who their physician is. And I like these too, so I wanted to share a way to close the call. So asking, is there anything else I can assist you with? And then waiting. The hard part is the waiting. Someone may say yes or no. And if they say no, these are some ways to continue to close the call. So asking them, oops, wow, I went jumping around there. Sorry about that. Here we go. So thanking the patient for choosing your practice for their medical care. Here's an idea also about how to respond if they're the patient's parent, and simply how to say thank you for calling the practice name. This is one of my bugaboos too. When we ask patients to sign forms and we ask for their signatures and we don't explain what we're asking them to sign, this is really disrespectful, I think, and something that you might be surprised your practice is doing. So when you're asking patients to sign necessary forms and to get their signatures, make sure that you're explaining what they're signing and that you're giving a copy, either right there in the moment or you're sending it to the portal so that the patient gets a copy. One that I often see is the financial policy and the consent for treatment. So make sure that you're explaining to the patient exactly what they're signing around the financial policy or their consent for treatment, and then give them an opportunity to actually read the document and ask questions. Now, this can be scary. If you're a new front desk person and you haven't been trained how to properly answer those questions, you're going to be a lot less excited about asking that last question. But if your supervisor has trained you appropriately in what the common questions are, you'll feel much more confident in asking. So I'm giving this presentation for people at all levels of the organization and saying, get comfortable with the fact that patients will have questions about the forms, about our processes, and be ready to answer those questions effectively for them. I liked this one as well. This is a sample phone call assessment that a supervisor can do for a team or a team can do for each other. But the types of things that we're looking for are answering time. So are the telephones consistently answered on or before the third ring? Do we use an appropriate greeting to all callers? Did the receptionist identify the practice and say him or herself? So, thank you for calling Dermatology Associates. This is Lauren. How may I help you today? Also, is the tone of the receptionist's voice pleasant? Do they sound friendly? Are they smiling when they're taking those calls? Are they using the caller's title and respectful titles such as Mr. and Mrs. whenever possible, especially when you're dealing with an older population? That's much more common. We expect to hear that kind of language than in a younger practice, for instance. Also looking at your documentation of your phone calls, making sure that the information is written down correctly and effectively or recorded in your practice management system, making sure that everything was clear in the questions that they were asking, that the expectations were made clear. Did the receptionist wait until the caller put down the receiver? So in other words, did they hang up first and not wait to see if the patient had a question? That would definitely be not acceptable. Here's some other things you might look for. The one that strikes me the most here, especially, is around the delivery of the message. So are messages delivered to the appropriate party? So not just, this is a message for Dr. Smith and I need to get it to him, but clinically, are we as the front desk or the front receptionist gathering enough information that the clinical team knows what to do next and how to effectively assess that patient if they're having a medical issue? So making sure that you have good triage protocols in your clinic so that clinical questions are answered effectively and timely is a very important piece of this work that we do. So here's a lot. I'm not going to go into each of these questions because we're almost to time, but I wanted to save this for you. So if you're a supervisor or a lead in your team, this is an entire checklist of 2 slides that you can go through and assess your staff and find out if you have gaps. And the first step in this is identifying the gaps, and the second step is filling them and providing the training and support that they need. There's a lot of great questions here for you on slide 40 and slide 41. And if you're wondering where some of this came from, there's a wonderful book called Front Office Success, How to Satisfy the Patient and Boost the Bottom Line by Elizabeth Woodcock. A lot of great tools in there if you're looking for something like this that you want to take just a little bit deeper. And then I know earlier we talked a bit about complaint management and service recovery, and this was a really great little graphic around how to create a best practice for your group or your hospital system for managing complaints and using them as a quality improvement tool. I wanted to tuck that in there for you too. All right, so we do a moment of reflection. Do you now have a better understanding of your role in the patient experience? And have you learned any new tools or behaviors that will help you deliver an awesome patient experience with every interaction? So feel free to type a comment or something in the chat if you have one on these reflection questions.
Lauren, no comments yet.
Okay. Fantastic. Well, hopefully at the end of this, you've learned something new, or you've observed a new tool or takeaway or something, or even just shed a new light on your particular role in how you can deliver excellent customer service and what the impact is on patients every day. So this is my contact information. I always put it on my last slides in case anyone wants to reach out. And one of my core values is responsiveness. So if you email me, if you link with me, or you send me a Facebook message, I will respond. So if you have additional questions or you just need a little encouragement or want a little bit of follow-up, please reach out. I want to be support to you however I can. So right on time, 2:59. I'll let you wrap up, Rondi Ann.
Yeah, that's awesome. You did get a couple responses here. Bob Jones, this was very good and learned some new tools, so that's awesome.
Fantastic.
Robertson, great presentation. Thank you. Tiffany Allen, thank you. So it was a great presentation, Lauren. And
Well, thank you for asking me.
Yeah, and you always come with great tools, and I appreciate that, and I know that clinics appreciate that. Just those takeaways that they can take back and use. I think it's just so helpful. So thank you.
Thank you.
And do you have any last minute thoughts or ideas?
No, I guess just to everybody take a deep breath and honor yourself and the hard work that you do. We've been through an incredible amount together with just the pandemic and with all the changes and everything we've needed to do to pivot to continue to take care of people. And I just want to say you're all amazing, and the care that you deliver to your patients is remarkable. And thank you. And I truly mean that.
Thank you, Lauren. And thank you for the presentation. Please don't forget to complete the survey, and we will see you again soon, and have a wonderful afternoon, everyone. Thank you.
Thank you.